Hey guys, my name is SaimaAkhtar, and in today's drug of topic, I will be talking about Taxol. And so the mechanism of action for Taxol is that Taxol regulates mitosis by stabilizing and preventing microtubule depolymerization, which causes cell cycle to arrest. And so the cell cycle is arrested in the G2M phase, which causes cell death. And so then if you can see or remember the G2M phase, it prevents damaged DNA cells from undergoing mitosis. And so you can kind of see in the figure that Taxol inhibits the G2M phase, which leads to mitotic arrest and which leads to apoptosis. And so this was a study that was done on human and hamster ovarian cells, and it was used to determine if Taxol was a phase-specific agent. And so this figure represents the cell survival of hamsters and human cells based on Taxol concentration. And so the experimental design was that they centrifuged these cells, washed them, and then planted in a Corning plates. And then the cells were determined by a colony forming assay. And so in the picture on the left, on figure A, we have the hamster cells, and then on the right of B, we have human cells. And so on the bottom x-axis, we have Taxol concentration in micrograms per milliliter, and on the y-axis, we have survival percentage. And so these cells were exposed to different concentrations of Taxol, and the survival of the cells were determined. And so what they found was that after exposure to different periods of concentration, the cell survival decreased with an increase in Taxol concentration, but then it hit a plateau. And for hamster cells, it hit a plateau around 0.8 to 1.6 micrograms per milliliter, whereas in human cells, the plateau was at 0.01 micrograms per milliliter, which indicates that there is a consistent sensitivity and resistance to Taxol, and that the survival pattern in the cells killed seem to relate more to an increased exposure time versus increased concentration. But regardless, we do still see that Taxol does decrease cell survival. So now just to talk about some cancer disparities. So there are two different articles that I found on disparities. The first one being racial disparities in treatment used for multiple myeloma. And so there was a new effective and more expensive treatment that was found to improve the prognosis of multiple myeloma. But in the study, 37% of the patients, which were Black, were less likely to undergo stem cell transplant, and 21% were less likely to be treated with bortezomib due to the fact that the treatment was just way too expensive. And in the second one, the trajectory of racial and ethnic disparities in the use of cancer screening before and during the COVID-19 pandemic, a large U.S. academic center analysis was done where time screening analysis was used to analyze the change in screening rates by race and ethnicity before and during the pandemic. And so before the pandemic, Latinx and Black individuals were less likely to be screened for lung cancer than white individuals. And during the pandemic, there was no significant improvement or worsening seen for lung cancer, but breast cancer screenings for Latinx individual was lower than screening before the pandemic. And so one way that I think that these disparities can be helped is by conducting a system where patients see healthcare providers who are in the same race or ethnicity as them. And so in the study, the lay workers intervention to improve breast and cervical cancer screening among Latinx in El Paso, Texas. These lay workers spoke the same language and were the same race and ethnicity, so it helped them to relay information better, and it conducted patient care more efficiently due to having a same background. So I think doctors and patients who can relate based on their background are more comfortable with each other, and doctors can provide more to them because they can relate to them. And so thank you for listening, and hopefully you learned something.